So now comes my nighttime routine, and I generally like to keep things really simple. I truly believe that less is more. So I don't overcomplicate my skincare routine at all, and you'll notice that a lot of what I use at night is similar to what I use during the day. So at nighttime, obviously, we have to remove our makeup, and I just use a Garnier micellar water, and I might have to do 2 rounds of it depending on how much makeup I've worn that day. Following that, I would again use Dr. Sam's cleanser in exactly the same way as I showed you during the morning routine. But then after that, pat your skin dry, and the first thing I would put on is my retinol. Now, you know that retinols are the cornerstone of anti-aging. They help to rebuild collagen, it helps you to even out your skin tone, and it's really something I officially committed to after I had my baby, when I had a lot of pigment change on the face in particular due to pregnancy hormones, and of course the lack of sleep did mean that the skin was starting to feel a little bit tired. And fine wrinkles were coming through. So retinols. Now, retinols come in different strengths, and you can get them just over the counter. And it doesn't need to be expensive to be good. It's really more important that you choose the right strength that's appropriate for your skin type. Now, because I tend to suffer from eczema and I get dry skin, retinols can be quite drying and quite irritating to the skin. So for me, I had to start super low strength and build up. And I found that this particular product has a strength that I tolerate, but it also combines it with hyaluronic acid, which is actually a humectant that draws in moisture onto the skin. So it can actually help to counteract any irritant side effects that I might get from the retinol. So I use this most nights of the week. On retinol-free nights, I do use a lactic acid product. And I've spoken about exfoliation before, and for me, a chemical exfoliant using gentle acids like lactic acid or glycolic acid is a much more gentle way of removing those dead skin cells. And I would only use this maximum once a week at night time when I'm not using the retinols, really as a way of keeping up with removing surface dead skin cells, getting you a brighter complexion over time. So that's the lactic acid. And then because I do tend to have dry skin, which is definitely a lot worse around winter when the central heating is on and the rooms are hot and dry, I would slap on the moisturizer. And I tend to stick with the ones which are designed for eczema skin in mind. There are loads of them that you can just get over the counter: Cetraben, Epiderm, Aveeno. They're all available without prescription, so you can't overuse moisturizer if you are eczema prone. So I tend to do that. And then literally before I go to bed, I might just have an additional boost of moisture, which is through hyaluronic acid. And as I mentioned before, this is a humectant. Humectants are molecules which are included in skincare products that trap moisture from the environment onto the skin. So I literally put this on just before bedtime. So that's my skincare routine at night. And I think it's really important to invest the time to understand your skin type, and stick with the things that agree with your skin. And once again, don't try and follow any trends.